In this video, I'm going to show you how to fix sacroiliac pain off to one side. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over some great exercises that are going to target sacroiliac joint or SI joint dysfunction and pain off to one side. Pain that tends to start in the lower back at the belt line goes off into the buttocks, towards the hip, possibly into the leg. The two big causes of SI joint pain and dysfunction are tightness and weakness of the muscles that support the pelvis and sacrum. So I want to break this video up into two separate parts to address this. In the first part, we're going to focus on activating the muscles and mobilizing the SI joint. In the second part, we're going to focus on strengthening everything to hopefully build stability and get rid of sacroiliac pain for good. All of the exercises work just a little bit differently, so go through all of them, take what works best for you. As a bonus, they can all be done at home, do not require any special equipment, and may give quick sacroiliac pain relief, even in as little as 30 seconds. So let's get started. Let's start with a great exercise that's really going to help target and isolate a painful, achy sacroiliac joint. I call this one the SI Joint Activator. It's best done at the edge of a bed. Lie flat on your back just like this. Whatever side that you're having pain, let's say it's my right side, I'm going to bring that leg up, bend the knee roughly at 90 degrees. The movement, I'm going to take my foot and I'm going to turn it inward as much as I can. From there, I'm going to take the hand on the opposite side and place it on the inside of the bent knee. The movement is I'm going to take my knee towards the other side shoulder, so in this case my right knee towards my left shoulder, but I'm going to resist against it with my hand. So I'm pushing into my hand and resisting against that movement. When you do this, you're going to feel a lot fire across the pelvis into the sacrum, that SI joint. Really focus on feeling that. Try to hold this one comfortably for about 5 seconds. You're just going to relax. On the next repetition, try to stretch into it even more. You want to do this one 10 to 15 times. After that, we're going to do a different motion to attack the SI joint just a little bit differently. So this time around, I'm going to take my foot but go outward with it as much as I can. I'm going to take the hand on the painful side, place it on the outside of the bent knee. The movement is I'm going to take my leg 45 degrees straight away from me like this, but I'm going to again resist that movement with my hand. When you do this, you're going to feel that SI joint activate, but it'll be just a little bit of a different feeling this time. 5 second holds with this one. You're just going to relax, take a breather, and then repeat this one 10 to 15 times. This exercise is what I call the seated SI joint opener. It's a two-part process that's going to help stretch and activate the muscles around the sacroiliac joint, but it also may end in a satisfying self-pop crack or release into that joint. This one can be done pretty much anywhere. We just need to sit at the edge of a chair. Have very good upright posture. The first movement, we're going to do what is known as a seated figure 4 or pigeon pose. Whatever side that you're having pain, bring that leg up over the other just like this. Rest the ankle over the knee. So when you look down, it should look like a figure 4. If this position is hard to get into, what you can do is straighten the non-painful side, put the painful leg over it, and then I'm going to pretty much grab the back of the pant leg right here, bring it up, and then slide the heel back into position just like this. Let's start with very good upright posture. The first movement, I'm going to take my hands, place them off to my hips right here, keep my back straight as possible, and I'm going to lean forward, pivot through the hips and through the waist. We don't want to round the back with this one. It's really going to target off to the side. It's going to hit the glutes, the piriformis muscle. You're going to feel a lot fire around that sacroiliac joint. Focus on that. You want to keep going forward until you feel a deep but comfortable stretch. Try to hold this one for 20 to 30 seconds. Do nice, slow, controlled breathing also. From there, come back up and relax. You can do that one 3 to 5 times. Just build into it just a little bit more. If you feel like it's still just not enough, we can start to incorporate some dynamic movements in there to target the muscles a little bit differently. So let's get back into our original stretch like this. But what I'm going to do is put my arms in front of me like this, kind of like a genie position, and I'm going to rotate my back in the opposite direction. So I'm going all the way towards my left. You'll notice that the muscles get hit just a little bit differently around the sacroiliac joint. Hold this one for 20 to 30 seconds, relax, and then do it towards the other side and see if that one helps too. You can also do a lateral bending motion to target more off to the side of the lower back. So have very good upright posture with this one. I'm going to pretty much stabilize off to the non-painful side right here with my hand. Put the other arm and hand overhead just like this. I'm going to pivot away from the painful side right here. You're going to feel a deep stretch going all the way down into the hip, into the pelvis. You hold this one for 20 to 30 seconds, come back up, and then relax. Go through all of those motions. If you feel like one is targeting your pain just a little bit better, at that point, throw more repetitions in, generally 3 to 5. What we can do to self-mobilize the joint in the next part is with a great isometric exercise. So I'm going to bring my legs down just like this. My legs are going to be roughly hip width apart. I'm going to take my hands, place them on the outside of my knees right here. The movement is very easy. I'm going to drive my knees out, but I'm going to resist against it with my hands. You're going to feel a lot fire across the sacrum and pelvis. Hold this position right here for about 5 seconds. You're just going to relax. You're going to do this for 5 times. Now here's the neat part. We're going to take our hands right here, put them together, and then place them in the inside of the knees. This time around, we're going to squeeze inwards. And I don't know if you heard it over the microphone, but actually my right side just clicked right there. Very good release into that SI joint. Again, I just hold this one for about 5 seconds. I'm just going to relax. I'm going to repeat this 5 times. It's just a wonderful exercise to really activate so much across the pelvis and sacrum and hopefully get it to self-pop, crack, or release. Give that one a try. This exercise is called the SI Joint Corkscrew. It's a personal favorite for many because it may end in a satisfying self-pop, crack, or release in the back and sacroiliac joint. This one is best done at the edge of a bed. Start lying on your side with the painful side up towards the ceiling. I'm going to take the bottom leg, keep this one straight, and then take the foot on the other side, place it right underneath the knee. Press down with that straight leg to create a stable anchor point at that foot so it's not sliding like this. Next, let's find our contact point, the sacroiliac joint. Start with your hand on the painful side, right around the belt line in the center of the back. You're going to go down a little bit and then off to the side. This should be the region of that SI joint. To help find it even further, what you can do is wing the knee up and down like this, and it will activate the pelvis and sacrum and help pinpoint areas of pain and tightness. You want to take the meaty portion of the palm and center over that spot. So it should look like you're kind of cupping your buttock like this. Let's put our head down. I'm going to take the hand on the other side and then hook right behind the knee. From here, the movement is very easy. We're going to do a rotational corkscrew movement. We're going to press into the pelvis, into the SI joint, and then hook and pull the knee down towards the floor at the same time. This puts a lot of good movement in there. And if it is locked up, you might get a sudden pop or release in the back and across the pelvis. But do not try to force this one. Only go for a deep, comfortable stretch. Hold this position for about 15 to 20 seconds. You're just going to relax, take a breather, and then on the next repetition, try to build into it even more. You want to do this for 3 to 5 repetitions. The best way to prevent sacroiliac dysfunction and pain is to build stability and strength across the pelvis and lower back. This exercise is known as the bridge. It's my favorite because it's going to hit pretty much everything that will help stabilize those SI joints. You can do this one lying flat on your back, in bed, or on a floor. We just need something like a large rolled up bath towel or a pillow to place in between our knees. What I'm going to do is squeeze in with my knees into that towel until I feel an activation into my pelvis. From there, my hands go off to the side of the hips right here. I'm going to squeeze into the towel as much as I can and then slowly raise my butt up towards the ceiling until I have a nice straight line from my knees to my hips to my shoulders. You should feel the core muscles activating, the lower back, the glute, the buttocks, the legs, all across the pelvis. It really just fires everything. If you're unable to get into this position, just raise up as much as you can. Over time, you will build strength and hopefully get that nice straight line. I try to hold this position for about 5 seconds. From there, I just relax, take a breather, and then repeat this one up to 10 times. This is how we can take it to the next level and focus a little bit more off to one side. So let's say that I have a lot going on my left side. What I'm going to do is a one-legged bridge at this point. So my other leg, the non-painful side, goes straight like this, and then I'm going to do the bridge only on that one side. You'll feel a ton fire. This can be very, very challenging. Again, for about a 5-second hold, you're just going to relax from there, take a breather, and then try to do this one 10 to 15 times. Even though you might have one-sided pain, I do recommend doing this on both sides to keep them in balance. So here's another great stability and strengthening exercise that's going to hit the pelvis and the sacrum just a little bit differently. It's a combination exercise I call the Dog Hydrant. You're going to start off on all fours. If your mattress is firm enough, you can do this in bed, but it's probably going to be easiest to do it on a floor. So let's start on all fours, tuck our chin towards our chest. Whatever side that we're having discomfort, let's say it's my right side, I'm going to slowly start to straighten my leg and then reach out with my toes. Keep reaching and gliding away from you as much as you can until you feel an activation of the muscles in the leg going all the way up to the hip and also the pelvis. From there, we're going to slowly raise the leg up until we feel a great activation of the muscles into the core, the lower back, the glutes, the buttocks, and also the leg. You want to hold this one comfortably for 5 seconds. From there, you're just going to relax, take a breather. The next movement is known as a fire hydrant, and you're going to see, for good reasons here in a second, why. I'm going to start off on all fours. What I'm going to do is raise the painful side up, keep my knee bent at 90 degrees, and then we're going to rotate our whole leg and our body upwards towards the ceiling. So it's a nice fluid movement of rotating like this. Go up as far as you can. You're going to feel a ton fire across the glute, a great stabilizer of that sacroiliac joint. Again, hold this one for 5 seconds comfortably. You're just going to come back down and relax at that point. But just do this complete cycle for about 10 repetitions and build into each movement and challenge those muscles. And when you're done on one side, I do recommend doing it on the other to keep them both in balance. If the exercises helped you, please support us by giving this video a like and maybe subscribing to the channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.